Okay, and we started recording. Okay, and I've got folks out of the waiting room now, so it seems like we can go ahead and get started. Well, welcome everyone to Resilience Week. This presentation is about policies to promote resilience, and we'll talk about what resilient policies look like as we delve into the presentation. Feel free to introduce yourselves in the chat. It's always helpful for us to have an idea of who's in the room when we're discussing topics that may relate to your professions. My name is Chloe Edwards with Voices. I'm a policy analyst covering areas related to health and wealth in communities. And I'll pass the mic to my colleague to introduce herself.
Good morning, I'm Emily Griffey. I'm the Chief Policy Officer at Voices, and we work on a variety of issues that ensure the health and child well-being, especially with a trauma-informed lens and a view on racial equity. So today we are pleased that you can join us and learn more about these policies. So Voices is a multi-issue child advocacy organization. At the core of our interest since the beginning of our 25-year existence has been interest in the child welfare and early childhood sectors. And beyond that, we really exist as an entity that looks at the whole child and promotes the child well-being and the family economic security that extends to that child well-being. Many of you may know us from our Kids Count Data Center, which has hundreds of indicators that hopefully those of you who are part of local trauma networks or other local focused groups can use to better understand child well-being within your local communities. We also work to initiate change and promote opportunities for justice for children through Racial Truth and Reconciliation Virginia. Let's give a shout out to Tiffany Haynes on here today too, who's our new advocacy and engagement manager, and we'll be working with many folks in that space as well. And we, especially around this point of valuing the experience of children, youth, and parents, and those professionals who are directly impacted by policies and programs. So if you don't happen to work with families, but are a young person or are a family today, we're also sharing policies as they impact you and your life and how you live it day to day. And so we want to hear more from your experiences as well, your questions, your comments on which of these policies are helpful to you as a person and person raising children in Virginia, working with children in Virginia. Next slide. So our objectives today are to raise awareness of the policies that are at the forefront of state and federal policy, to demonstrate the impact of how policies can impact our daily lives and impact you, whether you're a young person or a family, and then to hold a vision in place. To imagine a future where policies are focused on resilience and promoting that stability and not on deficits. So we'll talk a little bit about the role that you all can play as advocates as well to hold that vision and to make sure that we are focused on what can be and not just what we have been providing children and families. I also want to note that when we initially scheduled this, we were thinking this would be a great opportunity to learn more about some of the federal policies that were being implemented through the American Rescue Plan. I will note that we don't have all of the details on all of those policies yet. You may be hearing a lot of different federal changes coming, and we're going to walk through some of that. But just to note that today we're giving you this idea of the vision of what we can become, and more of the details are still being learned by us and by our federal partners as some of these policies come into fruition. So don't be afraid to be confused. There's a lot of policies right now, and it has never been a more interesting and exciting time to be involved in policies because a lot of these are very positive, but there are many things happening simultaneously and a number of things coming down the pike. So don't be afraid to ask questions. This is a chance to do that.
And it's an exciting and both unpredictable time. So when we think about policies that promote resilience, we go back to Maslow's hierarchy of needs. And so what it highlights in those first 4 levels are deficiency needs, whereas the top levels are needs known as growth needs. The idea is that you can simultaneously fulfill these needs, but once a person satisfies that lower level need, they're able to be more motivated to grow and reach that higher need, the growth needs. Growth often stems from the desire to grow as a person, which it does not necessarily have to be due to a lack of something, but we know that people feel stronger once they have been engaged in fulfilling their needs. They reach a goal called self-actualization. We know that everyone has the capability to fulfill their needs, but life experiences like divorce or the pandemic, for example, are things that can be barriers to meeting these needs. So our goal is to support individuals and think through kind of a continuum of care lens so that they're able to satisfy these needs as they go. Oops, sorry, I'm trying to do waiting room and this at the same time. So this opens up the question of what are policies that you all have experienced that may have promoted barriers. It could be in your day-to-day work as you're working with individuals and they're vocalizing some of the challenges that they have faced, or it could be something systemic or something that feels out of your control and would have to lead to a systems change. Any thoughts? And I don't think I'm able to see the chat since I'm sharing my screen. Yes, our PowerPoint will be available. So we can give you some examples of what we've come across, of what we call barrier busters in the policy field. And one example is that we know that due to someone's status of being an undocumented immigrant, for example, there are policy barriers when it comes to access to care. Currently, the only loophole would be an undocumented mother that is pregnant or has given birth to a child is the only loophole when it comes to accessing Medicaid, for example. But through policy and advocacy, we've been able to expand care through famous moms for immigrant mothers, particularly so that they have access to prenatal and postnatal care. The American Rescue Plan will also come with some healthcare funding that can contribute to benefits and can contribute to accessing benefits. An example of that would be decreasing the maternal infant mortality disparity, funding for community health workers, et cetera. And so as we navigate these barriers more, we're hoping to be able to identify more policy solutions to increase access to every person, regardless of their identity. Another example of a barrier buster is broad-based categorical eligibility, which we succeeded at this year through the General Assembly session. This will also increase access to children who receive SNAP benefits will automatically have access to free school meals too through this broad-based categorical eligibility too. Here's a big picture of what's coming for communities, as Emily mentioned, through these federal plans. It's a very exciting time, but also an unpredictable time as we're navigating all of these resources and hoping to shape what the implementation will look like here in Virginia to make the biggest impact.
And Chloe, if I can add here, we have a blog up that describes some of the changes here, especially since these plans all have similar names here: the American Rescue Plan, the Families Plan, and the Jobs Plan. And so what we're hoping is coming from these is the American Rescue Plan is what was approved back in March of this year, and includes a number of new policies to help recover from the COVID-19 pandemic. What's different and what you should be in your mind about the American Jobs Plan and the American Families Plan, these were also referred to as the infrastructure bill.
Hi, baby girl.
And so one thing that makes these plans different is that they are creating new ways that our federal policies can support families and can support resilience. I view the American Rescue Plan as the bridge from how things were pre-COVID to how we want our policies to work in a post-COVID world that is more just and provides equal footing for all children and families. We're right now at the stage of having the approved rescue plan, which is that bridge plan, and our vision of policies that we want to hopefully have in place that includes a wider variety of things to create equal footing for economically disadvantaged families, children of color, and some gender equity proposals are now at the proposed stage in the American Families Plan and American Jobs Plan. I'm going to talk about some policies as they might intersect with individuals or youth. We're going to go through a couple of different categories here, thinking about policies that promote that individual or youth stability, policies that promote the family stability, and policies that look at community-based or place-based solutions. So one thing that we'll do after each of these buckets is be able to pause and where you can ask any questions about what might be coming. So there are a number of changes to the way that you can receive tax benefits or tax credits coming from the American Rescue Plan. And these are important to note because what we have often with tax policy is that a couple of things to keep in mind, that credits are often given to you in a one-time payment, and that it requires you to file taxes in order to receive these benefits. A couple of things to note is that there's a number of significant benefits, so you really want to help encourage families to apply for taxes, encourage young people to apply for taxes so they can receive these benefits. It can be daunting to fill out your taxes online. It can be daunting to find help during the pandemic, but we want everybody here to be encouraging folks to do that. A couple other notes is that some of these policies will be coming into place in 2021. So for this current year, when people file their taxes next April or May. I have another resource here that I'm going to put into the chat with some help to find help filing your taxes and finding your stimulus payments. And don't forget to file by next May 17th. One thing here for individuals and young people to keep in mind is that young people, those up to age 24, have not been eligible for the earned income tax credit in the past, and the American Rescue Plan changes that so that they would be eligible during 2021. So young people who might not normally file taxes, even if they work part-time jobs, could be receiving some additional economic support in the coming year. So you want to encourage young people to have their materials in place to file for the tax credits here. Other things to note, I'll put also in a link to where you can find your stimulus payments in case folks have not been able to track those down. This was all really useful to me to know as somebody who, if you encounter working with individuals and families, that you may be able to help folks track down where they can access benefits or where they can access stimulus funds. And so there's another opportunity here about finding your stimulus payments. One thing that I'll note for these policies targeted to individuals and that come from the American Rescue Plan, again, they're part of this bridge idea, some policies in place for a short period of time that get us out of the COVID pandemic and can maybe bridge us to a more stable future. These policies right now are all in place in the short term for 1 year, and we'll need to work as advocates to show the need for the long-term commitment, long-term policy changes that will put these kind of earned income tax credits, child tax credits, other cash assistance and financial assistance for that survival mode in place. Move to the next slide. Another thing to note is some additional funding for children aging out of the foster care system. And I'm going to also put some stuff in the chat here. This is for youth who are part of the Fostering Futures program, aging out of foster care. Some funding for additional COVID-19 payments directly for youth aging out of foster care is now available through this September. You can access this online by texting. Sorry, I'm going to put this in the chat. My slides here didn't quite work out. Text Foster My Future. Anybody can get to know this information. We have can get to know this information and unlock these benefits. We have some information up on our website, and DSS does too, to be able to get to the Fostering My Future benefits. You do need to apply through a portal with DSS in order to achieve those benefits. So let's see. So targeted here, the key here is to understand that we have some benefits that are targeted to individuals, young adults, children from the foster care community, and to families to help provide their economic stability. So I want to give a chance here to see maybe a few comments in the chat if there are any questions about these payments or about these policies. Sorry. Anyone unmuting themselves to ask a question here?
How are people feeling about some of the federal incentives coming? Okay.
Well, they might be new information for you. As I said, it's been hard to keep up with the pace of federal policy shifting right now. And so if these are new information for you, make sure to flag, to bookmark those IRS websites about finding out about the stimulus payments and tax filing for the future. If you haven't filed your taxes, or if you need to encourage others to file their taxes, please go ahead and do that, or get your extension in. One thing that we also want to encourage folks to do is that to be aware that if they're an immigrant family and have an ITIN, and their child has a social security number, families can receive most of these benefits for their child. So when you are encouraging folks to file taxes and make folks aware of some of the shifting federal policies, particularly as they impact the immigrant community, encourage folks to file to get these economic payments for their children and their families. So we can move ahead. I think these are most of the links that I already put into the chat here. And go to the next one too. The one thing to pay attention to policies to promote stability for families is that we want families on a daily basis to feel like they're not in survival mode, that they're moving to monthly, yearly stability where they can predict what's coming, where they can find a path to be on a trajectory to improve their income, improve their professional qualifications at work. And so we see this expansion of childcare assistance as a great example of how families can achieve that. The General Assembly is taking advantage of new federal funding, particularly for childcare, to increase the eligibility levels. And we need to get the word out about this ASAP, because right now there is a short window for folks to apply through July 31st. Folks can apply online through Common Help or at their Department of Social Services. They do need to have a child care program selected for their child. But if they move through those steps of applying and having a program selected, they're now eligible at a much higher income level than before, up to $89,000 a year for a family of 4. It's the same income level throughout the state. And if a family has a child under 5, if you don't have a child under 5, still apply, and your children may be eligible for before or after care at the current eligibility levels. We no longer have the requirement for child support enforcement compliance. There are no waiting lists anymore due to COVID and having this additional funding. So do encourage folks to apply for childcare. And we want to know if folks are still hitting barriers at their local Department of Social Services through Common Help and needing help with translation or any other supports. We want to know if there are barriers so that your experiences can help shape how this policy can improve moving forward. Next slide. One other policy to be of note, again, for this type of stability for families that we talked about, is that the legislature approved a pilot to use some of our federal TANF dollars, which are those cash assistance funds for low-income families, to create individual development accounts or savings accounts, also called, the shorthand for that is IDAs. And the Department of Social Services is coming up still with the requirements and the eligibility for using these type of accounts. This is where we want to go to, and one of these dream policies, right, to help promote stability is to be able to fund savings and stability for family that can be used in the long run for that wealth building, home purchases, higher education, starting a business. And so we will be interested as the legislature rolls this out and looking for some examples here to highlight of how these types of savings accounts help families achieve stability, and hope that we can advocate for more of these type of policies that provide that long-term stability. There's $2.1 million this year that was set aside for those accounts. I also want to talk about families and how our family first approach is transforming our foster care system in Virginia. So we know that often the stability of a family does come down to some of those economic supports, as well as having those social networks and caregivers that can help step in for families and children in need of additional supportive adults in their life. The State Department of Social Services has been shifting to this family-based approach for children involved in the child welfare system, and 2 bills passed this session that will continue to amplify that approach, including financial support for kinship guardians that are approved by the state, and establishing a family first approach and defining fictive kin. So folks who are not blood relatives, but are close relatives and family to the family that can obtain support as a fictive kin. member for kinship assistance. So we're excited to see how these policies will move forward. They will start to be officially implemented in July of this year. Next is more about that family first approach here of looking at kinship families, foster families, therapeutic foster homes before families move to, before children get placed into those congregate care settings. If folks have questions here, I think it's a good time to pause. I saw one come up from Alicia that I will respond to in the chat. And then if other folks are thinking of questions, I think might be best if you raise your hand while I'm answering this, or say you have a question in the chat. Alicia asked about, are there enough early education slots to meet the increased demand? And so I don't know if we ever will fully have enough slots. The idea here is that we're hoping that families drive the demand, and we're not waiting for the slots themselves. A couple of other policies that are coming into place that could help on the supply side there too. So we're hoping that the supply of early childcare has been bolstered by having some CARES payments or recovery payments paid directly to those childcare providers during this time. Policies that we passed this legislative session also look at changing how the state pays for childcare in the long run. That long-term vision of moving to a new way of doing things, so that we can pay by the true cost of quality and what goes into the service, and we can do some grants and contracts with providers so that we can bolster the supply side of the early childhood equation. So ensure that there are slots available at high quality centers that will participate in the federal funding programs and state funding programs through that contracting method. So moving forward on those policies, they have been approved, and we anticipate through some of this additional federal resources that more will come in line to increase the supply. Any other questions about these family-centered policies? Thanks for that, Alicia. Go ahead, Chloe.
Thank you. So looking at solutions at the community level, the idea is to strengthen communities because communities support families. So it goes back to that continuum of care and that wraparound model. So we'll go through some examples of this. One thing that I did want to flag is that the American Rescue Plan does provide billions of dollars to help states, localities, and tribal governments. We're not quite sure exactly what this funding will look like in implementation in Virginia specifically. But if you're trying to figure out what may be coming to the community near you, you can read a blog from the Center on Budget and Policy Priorities about some of the comprehensive incentives coming. We do predict that a special session will likely occur in June or July. And so there may be some opportunities to engage in advocacy as well. So subscribe to the Voices blog. We'll put a link in there at the end of this presentation so that you can be the first to know about some of the incentives coming. Right. And around food and nutrition access, this became a growing trend. We've been working with our trauma-informed community networks who live in rural and urban communities, and the continued theme of food desert continues to be a challenge. So not only do we want communities to have access to food, but we also want them to have access to fresh and healthy and nutritious foods. The Virginia the Virginia program, Virginia Food Investment Program Fund, increased funding $3 million to create retail incentives in urban and rural communities that are facing these food gaps in order to build up some of that infrastructure that is needed in these communities. Another complementary bill that was also championed by Delegate McQuinn is the Virginia Produce RX program. How this program would work in implementation is that an individual would get a prescription from a qualified medical provider for healthy, nutritious foods. This is someone that's in your Medicaid CHIP population. And then they could use that prescription at their local market in order to gain access to those healthy foods. We didn't get this program funded this year, but what we did get was a study that passed in order to look at what the implementation of this program would look like in Virginia. So that was a very good policy step. And so we'll come back and ask for funding another year based off of those recommendations. When it comes to looking at the social determinants of health from a broader lens, we also know that issues like racism or community level issues such as stigmatization of mental health continue to be a community level issue that does impact family members and individuals on different kinds of levels. And so Marcus Davis Peters was a young Black biology teacher that was shot by Richmond police in 2018. He was in the midst of a mental health crisis. Advocacy efforts led by his family and by the community led to the passing of the Marcus Davis Peters Act. What this would do is build a crisis response system through mobile crisis teams in order to stabilize mental health at the community level. The idea is to divert intervention when it comes to mental health from law enforcement and into a more community-based intervention from a mental health professional. And so this act would create mobile crisis teams where, depending upon the level of threat, law enforcement would be paired with a mental health professional, as well as, depending upon the teams, a peer support professional, community-based professional, et cetera, to respond to the crisis. We're still in the implementation of what this would look like in Virginia, but we do encourage folks to get involved in the informing what this should look like. The stakeholder sessions are open to the public. And so we always welcome public comments. A complementary bill was also championed by Senator Jeremy McPike, which would create a universal hotline or crisis call center line. Again, the goal is to divert the calls from law enforcement into a more 988 crisis hotline so that we can get folks community wraparound supports outside of what law enforcement could offer. Going back to that theme of community-based supports, we know that children have increased access to health services and mental health services when it's in a school center. So Senator Donovan championed the free care for school-based health services, SB 1307, which would increase Medicaid coverage and reimbursement for school-based mental health. Other complementary bills were increasing support personnel in the schools. This would include your social workers, psychologists, counselors. We're hoping to get that ratio down to 1 to 250, but we did make some leeway this year for 1 to 325 for school counselors. There was also another incentive to fill the support personnel in the schools by a set deadline. The idea of, as far as when we're thinking of these American Rescue Plan funds coming, the CARES Act funds coming previously, are that these best practices are things that we could have been using the entire time for families to reach their full independence. And so the framework we're thinking through is getting families past that survival point when it comes to that hierarchy of needs, those standards that must be met in order to survive, to stability, and then mobility, which goes back to that, the growth and their ability to meet other needs. We know that trauma-informed community networks, neighborhood centers, and other community-based providers are, one, trusted in their communities. So sometimes it supersedes the service that is being offered, but who do community members trust? And we saw that through the pandemic when there was intervention from community-based resources or neighborhood centers, helping families through emergency grants or through diaper and food banks and much more. So thinking of our dream list and dreaming a bit, we would love to see more models that follow a neighborhood or place-based resource model. Family and Children's Trust Fund did have emergency grants for trauma-informed community networks during the pandemic, serving as that trusted community resource for utility assistance or transportation car repair needs, just so that families are able to once again survive and thrive. But other models that we see have worked are models that have some sort of mutual aid component and wealth building component, as well as a one-stop shop where families can get what they need as it relates to health and wealth. Other examples, as well as how we can mobilize in our communities, have been the ACERS interface trainings that trauma-informed community networks often offer. And so we were pleased that the General Assembly did a lot more funds to ACERS interface master trainers this year too. Virginia is the first state in the South to explicitly declare racism as a public health crisis. We know that a growing body of research has shown that centuries of racism in this country has deeply impacted those where individuals live, work, and play in our society at the individual, the institutional, and the systemic level. Social determinants of health are key drivers that when we're able to fully invest in and overcome racism as a public health crisis, can foster resilience in communities so that communities can thrive regardless of their racial or ethnic identity. So Delegate Lashley's-Air did carry the resolution to first diagnose the problem. We know we have much more work to do in deconstructing 400 years of oppression, but we know that once we diagnose the problem, we're able to develop a treatment plan. What she's outlined is key priorities that the administration and the Virginia Department of Health can take, including expanding the Virginia Department of Health's Office of Health Equity in order to examine biases and policies leading to poor health outcomes, to best practices implicit bias training for elected officials or public providers as well, because biases have impacted outcomes within our systems, and community engagement with those most impacted. And another key is the recommendations that will come from the Commission to Examine Racial Inequity in Virginia law. And so we'll be awaiting their recommendations as well in order to adopt those. Again, we have much more work to do, and this is symbolic, so it's a first step, and we'll definitely need to come back with some key funding, but some best practices that we did see during session, for example, was racial equity impact statements for the criminal justice sector specifically. And so we can continue to look at those best practices and transcend it to other policy areas as well. One benefit that the American Rescue Plan could offer is more community health education investments, or more investments for community health workers through potential CDC funding. And so this is an area that Voices would like to continue to explore in order to increase access to health at the community level, and then also having that health education come from trusted community members like community health workers. So let's stop and ask if anyone has questions.
Thanks for sharing your resources with each other about ACE's interface training and how you're engaging at the local level. I wanted to point here too, for those of you who are a part of trauma-informed community networks or who really work at the local level to shape policies, you have the opportunity to extend this vision for the resilient policies, the things that give families a leg up in the long run, through your work at the local level or the state level or the federal level. Our local governments are also going to be receiving funds directly from the American Rescue Plan, where your county administrators or city council or mayors are going to be making decisions about how to use that funding. The amounts are still being determined, and any rules about how the funds are going to be used are still being determined. But be on the lookout for more information and opportunities to weigh in at the local level. You have the opportunity here to identify ways to support your work locally, to build together a group of advocates at the local level who are also working to respond to these issues through some of these opportunities as well. Imagine it similar to the CARES Act fund that came to the locality for that survival mode of getting through the pandemic. But in this case, the American Rescue Plan funds, with that bridge mentality, allows localities to spend it over a longer period of time and to be thinking about promoting those policies that are centered in that equitable response and a better future for families, support family-centered practices in the long run. So hope that you can share that vision in your local work.
Were you speaking, Emily? You cut out.
Yeah, I'm sorry, Emily. Your sound went out. But there are opportunities to raise your voice when it comes to these incentives. One thing that we learned throughout the pandemic and these the federal funds coming is that we can dream a bit and we can raise our voice when it comes to some practices that we could have been using the entire time, like telehealth or community-based health education. So with that being said, there may be some opportunities to advocate for more prevention funds, for example, for trauma-informed community networks that we haven't been able to get the past 3 years. And so that kind of leads us to our next slide of what advocates can do at the state level and the federal level to engage in advocacy and policy change. But Emily, we could see if your sound is working now, if you wanted to finish your thought.
Yep, unmuted. So one thing that I was going to share is that, you know, with folks who wanted to get involved locally, I think Alicia also asked, is there an example of states who are doing this best? And we're all figuring this out right now. This is a stage where the federal government is figuring out the rules about how some of these funds can be used. States are figuring out their piece of the puzzle about what they can control. Local governments are figuring out the rules about what they can control. And then we're getting some of these supports that are directly to families that are going to be changing their economic picture, their bank accounts on a month-to-month basis. So we're all in this process of figuring it out. I think what we want advocates to be able to do is to hold that vision of when things didn't work before, when there were barriers in place, when people had to go through hoops, when some groups were marginalized. What was it about that didn't work? And how do we get rid of that to make a better policy, to make better, more resilient policies moving forward? What exists as a value and a resource in your community that you believe at the local level is truly a thing that makes your community unique and strong? And how do we do more of that? And so how do you share that story that success, those glimpses of the possible with those folks who are making the decisions and making the policies. And we're here to help you do that, to help do some of this translation as we're all figuring out what these different federal policies will allow us to do. But we also believe you really know what your community needs and what you can build on to support it. I was going to share one example from the other best practices around the family resource centers or the neighborhood resource centers, which is something we don't have a ton of in Virginia, but if you look, there's a family resource center national network that I'll share, with the idea of using more smaller based community centers, trusted folks with those trusted relationships, folks who were able to be nimble and provide that sort of mutual aid support during the pandemic and so the survival mode. How do we help build those up as great examples so that we can keep that kind of positive resource community context in place as we move forward? So we'll be totally interested to hear more from you all as you have examples of how that might work. If you have examples about how your trauma networks are helping to provide that connective tissue between organizations at the local level or at the neighborhood level, we want to hear more about what is working and what can be built on in your communities. So that was my thought from earlier. The two things to pay attention to. So hopefully you'll have those conversations at the community level. Think about what you're envisioning for resilient policies. At the state level, we think that there will be this short session to respond to the American Rescue Plan sometime this summer, June or July, after a lot of that information about how the funds can be used comes into place. And then over the summer, the Congress will be getting bills that include the proposals from the American Jobs Plan and the American Families Plan. They have not yet been officially introduced as legislation in Congress, even though they contain a number of excellent ideas that you might have heard more about, the Building the Infrastructure Plan. Once those are in place, I'll let you know more there. The leaders of Congress have indicated that they would like to get some of these bills passed this summer. So you may be asked to participate in a federal town hall, a congressional town hall, to get to know more about these policies too. The best, easiest thing that you can do, if it's just one thing today, is go to who'smylegislator.com. I'll put in the link and make sure you know who is your local legislator, who's your congressional representative, and our two senators, Senator Warner, Senator Kane, and how you might be able to follow them on social media or get in touch with them during this time so that you have an awareness of who those folks are. If you don't know your local representatives, I don't think they come up on that link, but there's another link I'll put in here for VPAP that should provide that information for your town councils, your board of supervisors, and those representatives. Chloe, do you want to do the next slide?
And so we're pleased that you all spent your Resilience Week morning with us. This is the second day of Resilience Week. If you really, really want to spend more time with us, we have two other presentations coming up. One is at 11:30 today, and the other is on May 5th at 10 that you can also join. And this is our racial trauma and resilience trainings. Well, we'll talk more about some examples of not just policy barrier busters, but just systemic issues that lead to, that impact the resilience of communities, families, and youth. If you'd like to connect with us on just any issues in general, these are our specific areas that you can contact us regarding. You can also join our network meetings. We have a network in each of our issue areas. You can join the Racial Truth and Reconciliation Virginia Coalition as well. And then we also have committees that's a part of that too. So here's our contact information. And that's it. If any questions?